We've shown you photos of some pretty extreme medical conditions, so here we go again with some of our most shocking yet. It's time for What Is This? What Happened? And Could It Happen to Me? Starting with this image. Anyone know what this is? The reason this man's eyes turned blue ended up being due to medicine that he was taking. He had been taking minocycline, it's an antibiotic, as a treatment for his inflammatory arthritis, had been on it for 15 years. And one of the side effects is this blue discoloration. You were saying that because you use this for acne, that you have patients who develop this.
Correct. So this minocycline is an antibiotic, but it's used as an anti-inflammatory. So it's often prescribed for autoimmune conditions. We prescribe it for acne, for rosacea. And the thought is that there may be a byproduct of this drug over time that complexes with melanin and forms this very characteristic blue-gray discoloration. So if someone's been on this about 5 years or so, about 50% of people will get this discoloration, whether it's in their gums, on their skin, especially at sites of trauma, and then certainly more rare, but in this case, in the sclera of the eyes.
And no, I know what you're thinking. This is not a good way to get blue eyes.
No. It's in the part that's white, yeah, definitely.
So you have to be very careful then.
Yeah, but you only see it after prolonged use, right?
Prolonged use, but I will say that minocycline, I usually cut my patients off after about a year because it's one of those medicines that for some reason really seems to trigger a lot more inflammatory response, even though it's used as an anti-inflammatory in the body. So we sometimes see drug-induced lupus from it. We sometimes see autoimmune hepatitis. Certainly the discoloration that you're seeing here.
And that's, so this is...
Not to the same degree that other tetracyclines. It affects your gums, though. You'll see this gray deposition in the gums.
Even after he stopped, he still had the blue discoloration, so it can be permanent, right?
Yeah, it doesn't always go away. It can, but it doesn't always go away when you stop the medication. So.
It's always why you want to make sure when you're taking a medication, you read about all the potential adverse effects, because if you started to see this, you'd want to get off that medication ASAP. Luckily, it's not a super common prescription. I've never prescribed it. I don't know about you two, but it's not one of those oh yeah, here you go, here's some more minocycline, but as a specialist. So just be aware of that. Anytime you see any new discoloration, you want to get that checked out. I want you all to look at this next picture. Anyone have an idea in the audience what this might be? Well, this is a 31-year-old man, went to the ER after 2 weeks of ear swelling. For the past 6 months, he struggled with weight loss, fatigue, as well as aches. Dr. O, what was going on?
You know, if you just saw that without that history, you could think maybe it was trauma, that he's a wrestler or something like that, and he had wrestler's ear, cauliflower ear. But this is a totally different condition. Have you seen it, relapsing polychondritis?
Yeah.
Not super common, but you do see it. What it is, an autoimmune process that affects all the cartilaginous structures in your body. So what's affected the most? Well, your nose has cartilage in it, your ear has cartilage in it, your airway has cartilage in it. So you see those areas that are inflamed, that become deformed, as well as pain in the joints. How do you treat it? Steroids and, managing the condition. You may have to do specific things for the airway, and, the cosmetic changes, difficult to treat, but sometimes you can do, reconstructive surgery in those areas.
I think a rule of thumb is when you're seeing a photo in the New England Journal of Medicine, which is where this photo is from, it's pretty severe and it's not that common.
Yeah, but I've seen in my residency, I saw cases like this.
It's impressive.